Okay, we're going to break down Achilles tendinopathy today. What is it and how do you treat it? Firstly, what is the Achilles tendon? So tendons, broadly speaking, attach muscles to bones. Okay, the Achilles tendon specifically attaches our gastrocnemius and soleus muscles to our heel bone. Okay, so those are two big muscles in our calf. It attaches those into our heel bone. I'll show you a picture in a moment. It's very thick and tough tissue. So it's a really, you can see your Achilles, you can feel your Achilles. It's very thick and tough tendon. It has elastic properties, so it does have a little bit of stretch to it. And it acts as a spring when we run. So you want it to be stiff and springy rather than slack and loose. So that term stiff sometimes has negative connotations, but we want our tendons to be stiff and springy, because that means that when we're running, they can act effectively as a spring. So as every time your foot hits the ground and you kind of put your weight into that leg as you land, the Achilles tendon will stretch slightly and it will lengthen slightly, and then it will snap back to its shortened position. And that's kind of free energy, really, because you're not using your muscle to produce that. That's kind of stored energy in the tendon. So if we can utilize the tendon effectively, it actually improves our running economy, takes load away from our muscles, and contributes a lot to running efficiently. Okay, so quick video just to show you the Achilles tendon and its muscles. So this picture shows without the Achilles tendon and without the muscles involved with the Achilles tendon first. Okay, and then we're going to add one muscle, which is our soleus, and on top of that, our gastrocnemius. So two muscles, they attach into our heel bone. Long tendon, thick tendon, takes up to 8 times our body weight as we're running, so very resilient structure. When it comes to Achilles tendon problems, so we refer to it as a tendinopathy. You hear the term tendinitis a lot, but that term's kind of been moved away from, just because it implies that there's an inflammatory process in the tendon, whereas we're thinking these days that tendon pain is more due to like a disruption of the structure of the tendon and some different kind of chemical changes that are not typical of a classic inflammatory response. So we kind of use this term tendinopathy. And there's two key subcategories, two key locations basically where you can get Achilles tendon pain. The first one is the mid portion. So as the name implies, that's kind of midway through the tendon. And then the second one is called insertional Achilles tendinopathy, and that's where the tendon attaches into the heel bone. So you can see on the picture here, it's either kind of midway through the tendon or it's right in that kind of heel. Can feel quite low down for a lot of people, because that Achilles tendon does attach, it's got quite a broad attachment into the heel, and it does run quite low down into the heel, maybe more so than is demonstrated in this picture. Okay, so it's good to know which of these you are struggling with, because the management will just differ slightly based on which type of Achilles tendinopathy you have. What are the symptoms of Achilles tendinopathy? So localized pain at the tendon is an obvious one, but it's a key one. We don't expect too much spreading of pain when it comes to Achilles tendon pain. Certain pain conditions, you can get like referred pain and pain that spreads around. With Achilles tendon pain, it tends to be pretty localized to the tendon. Key one with regard to knowing that it is definitely tendon pain, classic tendon pain. Key couple of points actually. Pain levels that increase proportionate to load. So what I mean by that is basically your pain level will increase incrementally the more that you load that tendon. So for example, if you did like a 2-legged calf raise, you push up onto tiptoes, that might cause a bit of pain, but you'd have worse pain if you did that on one leg as that load in the tendon increases. You'd then expect more pain if you added a 10 kilo weight, you'd expect that to be a little bit more painful. And you may get pain if you load it more explosively. So like with a hopping or jumping movement, you'd expect that to be a bit more painful. So classic tendon pain has that nice gradual proportionate increase of pain in line with the load, whereas certain other causes of pain in this area won't follow that pattern as much. We expect pain that is there at the start of the run. So when you're not warmed up yet, it tends to be a bit tender. Then it may warm up a little bit and dissipate a little bit when you're getting into the run a little bit more. And then potentially if you're going on a longer run, then it may increase again as you start to fatigue, as the tendon fatigues a little bit, as your muscles fatigue, and you're just fatiguing in general. You may find that your pain kind of creeps back a little bit towards the end of the run. Another classic one is pain that's kind of worse after the run. So we want to monitor this 24-hour response a lot of the time, and potentially longer than that in a lot of people. And we can find that the pain is kind of bearable during a run, but it's afterwards that you're really paying the price, potentially for those few days after, or maybe even longer in some cases. So it can be a tricky one to manage because you kind of think that you're okay during, but then you really know about it afterwards. We know with a lot of tendon pain, and definitely Achilles tendon pain, it can drag on for months and years. If it's not managed well, often you'd expect it to take longer, of course. Even if you are managing it well, it still requires a lot of patience. It can take time. Okay, if you don't have this pattern that I've just described, then it may not be the tendon actually causing your pain, because there are some other sources of pain in this area that I won't get into now because there'll be whole kind of presentations in themselves. But there are other sources of pain in this area that can cause pain that won't match this criteria as much. So we do very much expect this classic pattern with your tendon pain. I'm just going to show you a couple of videos that just demonstrate what one of the key differences between mid-portion and insertional Achilles tendon pain. And we have this concept called compressive load that applies to a lot of tendon conditions. With the Achilles tendon, this concept applies to insertional Achilles tendon pain, but not really to mid-portion tendon pain. So it's something that we need to look out for in those cases that are insertional Achilles tendon pain. Credit to Running Reform on Twitter for these videos that I'm about to show. Okay, so if we look at what happens with the Achilles, as you go into that lower position, what happens is because the tendon kind of wraps around the heel bone as it attaches, when you're in that deeper position, you get a bit of compression of the tendon into the bone. And the next video will just explain this a little bit more. So this is analogous to what's happening here. If we imagine that this cable with a weight is the tendon and the wheel here is the bone, when you wrap that tendon around that bone, that will compress the tendon into the bone. So you can imagine how that would happen. If we go back to this one for a moment, you can imagine how when you're in that lower position, you're wrapping the tendon around the bone, and that can cause a bit of pain. So we have to look out for this position with Achilles tendon pain. Okay, what causes Achilles tendinopathy? So essentially, like with a lot of tendon problems, the main issue is just too much too soon. So people going 0 to 100 with their training, whether that's in terms of the amount of distance, whether that's kind of bringing in too much speed work too soon, any of these kind of variables that we can manipulate, we need to be gradually introducing different variables into our training and gradually building our training load up. So you can think of it as an overload injury. The tendon is being overloaded relative to its capacity. But essentially, the tendon should adapt to being loaded as long as you're building up your load slowly. So it kind of is an overload injury, but the tendon can deal with quite a lot as long as you are introducing that load gradually. and on a tissue level, we get a disruption of the tendon structure, the collagen layout of the tendon, and you can get some swelling with this as well. So it's not a classic inflammatory response, it's more of a disruption of our collagen layout in our tendon, and that can change that can lead to some local chemical changes and potentially swelling in the tendon. So that's kind of the pathology that's involved in tendinopathy. In terms of treatment, so there's two key things, and if you're doing these two things, then you're giving yourself the best chance possible of recovering from your Achilles tendon pain. I wouldn't worry about loads of other kind of supplementary adjunct type treatments like massage and stretching and stuff like that with Achilles tendon pain. The two key things are, number one, load management. I'll get to number two in a moment. So we'll explain load management first. So this just refers to how much running you're doing. So we need to be stripping our running back to a level that ensures two key things. Firstly, you're not pushing above maybe a 3 to 4 out of 10 on a pain scale during a run. So you're getting relatively low, manageable pain during the run that's not kind of throwing off your gait too much, that's not constantly on your mind as you're running. You're able to push through that pain relatively comfortably. That's number one. And then number two, and this may be even more key, is that we want your pain to be settling back to pre-run levels within 24 hours. Okay, so it doesn't have to settle immediately after, but we do want it to be coming back down within 24 hours. If it's not meeting those two criteria, that means we're doing too much and we're overloading our tendon. We're not allowing it to settle down. Okay, so we want to find that level with our running. So we can keep running. It's okay to keep running in most cases, in a lot of cases, unless you're having a really acute high pain level flare up. Normally we can keep going, but we need to strip things back, and then we're going to gradually build back our running load in line with our improvements in symptoms. Number two is progressive loading exercises. Okay, so we're looking at specifically loading the tendon using targeted exercises. And this will build capacity and resilience in the tendon and reduce sensitivity. Okay, so our process with this is to take the goal, the end point that you're trying to get to, and then think about where our entry point is with these exercises, and then we're going to progressively build up using a list of gradually progressing exercises to bridge that gap. Generally, we want to start with heavy and slower movements and progress into faster movements. Okay, so just to break that down a little bit more, so basically we're referring to exercises that are targeting the calf and the Achilles tendon. So I'm going to show you some examples in a moment, but for the most part, things like calf raise variations, we're going to find a version of a calf raise or a version of an Achilles tendon loading exercise that you can tolerate as a start point, and then we're going to gradually build up, and we expect the tendon to adapt and desensitize as we progressively build these exercises up. So this just demonstrates that load management and the gradual build up of our running load as well as our exercise build up. Okay, so at the top in the blue, we've got the running. We're looking for, along this spectrum of 0 to 100, where's your entry point? What can you tolerate right now in line with that pain criteria? And then at the bottom in the red writing, we're looking at our progressive loading. So where's our entry point in that sense? What can we tolerate in terms of some loading exercises? And then we're going to gradually push you up towards 100 in line with your symptoms improving. So what kind of exercise would we actually use specifically? Calf raise variations is the big one. So there's loads of different types of calf raises, and we're looking for what's suitable for you as an entry point. Okay, so this one that I'm showing you here is a single leg calf raise off a step. with a dumbbell. There's a couple of ways. So if you tried that out and that was too painful, then you may go to 2 legs. You may start without weight. You might not use the step to start with, particularly with that insertional Achilles tendon pain. Okay, but this is the basic movement that we're looking to work with. Okay, so we've got a straight knee version, which classically we think biases the gastrocnemius muscle, and then to target the other big muscle in there, the soleus muscle, we're going to do a very similar movement, but with a bent knee. Okay, so similar movement with a bent knee, just biases the soleus muscle a little bit more. Okay, so we probably want a straight knee exercise and a bent knee exercise. Doesn't have to be this one or these two. It can be double-legged at first. It can be without a step. You could just do some static holds in the top position at first if that was too painful. The start point for everyone is going to be different based on your symptoms. Other options, so we can do similar movements like on a leg press machine here, where this would be like a straight knee version. You could do a bent knee version on here as well. The top picture shows the Smith machine, which is actually a really good way of doing calf raises as well. So you can do a bent knee in a seated position. You'd have a little cushion on your lap to stop the bar being painful. And you can do the calf raise movement there. You could do a standing version with the bar on your shoulders as well. And then you can use these calf raise machines that some gyms will have. So on the left is a straight knee calf raise. On the right is a bent knee calf raise machine. Okay, so these are all good options. It's just finding what's suitable for you. So what can you do without pushing above a 3 or 4 out of 10 pain? And again, that pain should be settling within 24 hours after the exercise. Another option that doesn't quite fit in the category of calf raises, but I quite like, is just some tiptoe walking, potentially with some weight. This can be a nice start point for some people if the calf raise is a little bit too painful. What we probably want to progress to with runners a lot of the time is some plyometric loading. So plyometrics is basically jumping and landing type exercises that don't spend too much time on the ground. So you're trying to explode back up off the floor quite quickly. These may not be tolerated super well early on if your tendon is quite painful and reactive, but we probably do want to progress to these eventually in our rehab alongside some calf raise type variations, which will probably be staying in the program for a long, long time in our rehabilitation program. So some examples of some plyometric exercises: simple hopping on the spot here. You could do this on 2 legs. If one leg was a bit too painful, you could try to go higher. You could try to go forward or backwards or side to side. There's lots of variations that you can use with those. That's a simple kind of plyometric type exercise, which is useful for runners. Other things like this is called a depth jump, which would involve kind of loading into that leg as you land and exploding back up. This will be quite a lot of load going into the Achilles tendon, so it's probably a little bit further down the track for a lot of people. But essentially, we're looking for that progressive process where we're looking for your entry point and we're gradually building up. And we have to give it time because this stuff takes months a lot of the time to really get meaningful changes in the tendon. But this stuff is effective for the vast majority of people if we can stick to it. So just to summarize all of that, so our key things are load management and progressive loading. So if we're doing those 2 things, we're giving ourselves a real good chance of progressing. With the load management, we're looking to strip the running back to a level that fits within those acceptable pain guidelines. And then with our progressive loading, we are going to strip back, find an entry point that we tolerate, and gradually build up. Generally starting slower, progressing to faster movements. We don't want to fear going heavy as long as we're within the pain guidelines, because we need the Achilles to be able to withstand a lot of force. There's 8 times your body weight going through your Achilles tendon when you're running, so we need to prepare it for that with our exercises. We need to be meaningful. And lastly, be patient. Even when you're doing the right things, it will still often take months to improve.